Please welcome Cixin Wang, Associate Professor of School Psychology.
Hi. When you hear the words Asian American, what are some things come to your mind? Some people might say they are model minorities, they are smart, they are good at math and science, and they do not experience much difficulties and are doing well financially. However, this pervasive master narrative of Asian Americans as model minorities and doing well financially is simply not true. The Pew Research Center showed that 1 out of 10 Asian Americans live in poverty, and the poverty rates vary widely among different subgroups. Certain Asian American subgroups actually have very high poverty rates. It can be as high as 25%, twice the national average. Asian Americans have also been historically perceived as perpetual foreigners, not American enough, disease carriers, or yellow peril. And the yellow peril narrative actually resurfaced during COVID-19, when politicians blamed Asian Americans for the COVID-19 virus, called the Chinese virus, which invoked widespread fear, distrust, and violence and terror attack towards Asian Americans. In collaboration with Dr. Carissa Cheer at University of Maryland, Baltimore County, our research team have collected data from more than 600 Asian American parents and some of their adolescents. And the data show that Asian Americans experience very high level of racism. So in 2020 alone, and about 50% of Asian American parents and their youth experienced direct racism, and 75% of them witnessed racism towards other Asian Americans. And the prevalence is even higher in 2021. Any of these racism and racial discrimination predicted more mental health problems. However, in our interviews with Asian American parents, they said that even though they experienced racism or they are worried about racism, they did not talk to their youth about how to respond to racism. They worry by talking about racism in the classroom, it will emphasize the difference between Asian American kids and non-Asian peers and might contribute to more discrimination. They also worry having such conversations might make youth feel more inferior and hopeless. And this tendency to not talk about racism is not unique in our study. In a 2023 study by the Asian American Foundation, showed that 1 out of 5 Asian Americans living in New York City experienced physical assault and attack. However, 54% of them did not report any of these racial incidents to anyone. Racial discrimination has been repeatedly linked to mental health as well as health problems. So in order to address those racism, we need to do something about it. And for Asian Americans alone, and the cost of racial discrimination is high. Although suicide is the second leading cause for American youth in general, suicide has been found to be the first leading cause of death for Asian American youth since 2016. So that's before COVID. And in 2016 alone, suicide accounted for 1/3 of the deaths for Asian American youth. While facing such high rates of mental health challenges, Asian American youth are less likely to seek mental health services. In our research, we find that these low rates of mental health help seeking may be related to low mental health literacy, stigma towards mental illness, pragmatic concerns, as well as lack of culturally competent mental health providers. So in order to address racism and the mental health challenges, I have 4 recommendations. First, we need to provide culturally sensitive parenting programs for Asian American parents on how to talk about race and racism without reinforcing stereotypes or adding to distress in the family. We need to teach Asian American youth concrete skills they can use to respond to racism. Second, we need to make sure there's clear structures and procedures in place so youth and parents can report racism at school. Knowing that some Asian American families may be hesitant to report racism, schools need to make sure that they reach out to the Asian American families and reduce the barrier related to reporting. We also need to make sure there are clear consequences for engaging in discrimination and racism. Third, we need to empower Asian American youth and parents by teaching Asian American history. Next month, May, is the Asian American and Pacific Islander Heritage Month. And teachers out there, and educators and adults, we can all talk about Asian American history. Educators can embed Asian American history, culture, and role models in different subject areas. Asian American youth need to learn from their educators that Asian Americans are not perpetual foreigners. Asian Americans have made significant contribution to the US history. This way, they are able to create their own stories, their own narratives to counter the pervasive stereotype of Asian Americans. Fourth, mental health is a taboo topic for many communities, especially for Asian Americans. We need to provide culturally sensitive mental health literacy workshops for Asian American parents and adults. And youth mental health first aid training is one such program. It's an evidence-based, standardized public education program that teaches adults common signs and symptoms for mental illness and evidence-based steps adults can use to support a youth who is experiencing mental health challenge or crisis. However, some research show that mental health first aid is less effective for Asian Americans. So in my research team, we have been culturally adapting youth mental health first aid by incorporating voices from the community members, youth, and the parents, and embedding culturally sensitive metaphors and stories and examples in the training. And we found culturally adapted training to be more effective. In conclusion, schools, educators, mental health providers, and researchers, we all need to work together to support Asian American youth who experience racism and mental health challenges. Thank you.